So go ahead, Winian.
Okay. Good morning and welcome to everyone. If you are participating from a different time zone, good afternoon or whatever time. Welcome to the Division for Inclusive Social Development webinar on income insecurity, poverty dynamics, and COVID-19. I just want to, on behalf of our director, who unfortunately couldn't make it today, to warmly welcome everybody. Welcome to Professor Krishna and to all the participants for attending this seminar to share this moments with us. I think you will agree with me that the topic of today's webinar, that is income insecurity and poverty dynamics, are very important topics and highly relevant topics for the implementation of the 2030 agenda. And of course, now we are in the middle of a health, economic, social crisis caused by COVID-19. So the context, we cannot discuss such issues in a void of the context. See, the Department of Economic and Social Affairs of the UN, where our division is a part of, had been, since the onset of the pandemics, actively conducting research and analysis of the socio-economic impact of COVID-19. And our research so far had really showed the intimate connection between income insecurity and poverty, and how severe the adverse impact of COVID-19 could be on a country or a group of people, depending on those elements. So therefore, I think that today's webinar is really a very, very timely, it's on a very timely topic. And I thank Professor Krishna for coming virtually to share with us his latest research on the topic. So once again, welcome Professor Krishna, and welcome to all the participants. Now I will turn over to Marta, who is the moderator of the webinar, and Marta would introduce the speaker today. Over.
Thank you, Anyan, and good morning or good afternoon, everyone. I'm very pleased to introduce Professor Anirudh Krishna. He's the Edgar T. Thompson Professor of Public Policy and Political Science at Duke University. His research investigates, among other things, the dynamics of poverty, which, as Wenyan said, is a very relevant topic, especially in the current context. He has written several books, one of them called The Broken Staircase, The Paradox and the Potential of Indians 1 Billion, won an important award of the Association for Asian Studies. He's also authored other books, including One Illness Away, Why People Become Poor and How They Escape Poverty, which is actually the main topic of his presentation today. Before I give the floor to Professor Krishna, I have to give some practical instructions. All attendees to the webinar the micros will be muted throughout the webinar, but please, you are welcome and encouraged to ask questions, which you can write in the Q&A box that is on the, some of you may see on the right-hand side of your screen. If you do not see the Q&A box, you can go to the bottom of your screen. You'll see several instructions and options. You'll see one of the options has 3 dots in them. Click on it, and on the top of this panel box, you will see the Q&A, close and open Q&A box option. You can ask questions throughout Mr. Professor Anirudh's presentation, but we will probably, unless there's a burning question, we'll probably leave the Q&A for the end of his presentation, which should last about 20-25 minutes. Am I correct, Anirudh?
Yes, please, Martha. Stop me if I'm going on for too long.
Okay. So without further ado, the floor is yours. Anirudh.
Thank you, Martha. Thank you, Wenyan, and thank you all for being here today. I'm sitting in my home in Chapel Hill, North Carolina, feeling very foolish because every summer for the past 20 years, I've been going out and doing research in developing countries because the summer is the time I get an extended period of time to go and do interesting research, but this year I'm housebound. Anyway, I'm going to try and do three things today, and forgive me if I am a little slow at this because I haven't done this kind of lecturing too many times, but let me give it my best shot. So I'm going to try and do three things today. Mostly, I'm going to be speaking about my research on poverty dynamics. I'll speak a little bit about how the lessons from this research may or may not be relevant to what we can predict about the effect of COVID-19 on poverty in different countries. And we can do some part of this speculation together. And then at the end, if there's time, I'll speak very briefly on a new piece of research that I've been doing about social mobility and career ladders. And this is my spiel about how to build back better after the pandemic. So without further ado, let's go straight to the first of these topics, which is the research on household poverty dynamics. This research was guided by three key questions. First, it was a question that just came unbidden to me. I've been working on poverty for a couple dozen years already, but one morning I woke up and asked myself, where does poverty come from? Does everyone who's poor today, were they born poor? Can't be true, because if they were born poor and their parents were born poor and their parents were born poor, then there's a genetic cure, but that seemed ludicrous. So if some proportion were not born poor but became poor in their lifetimes, is that a big proportion or a small proportion of total number of poor people? If it's a small proportion, well, it doesn't matter so much. But if it's a big proportion, like if it's, 20%, 30%, then we should be thinking about what are the reasons for which these people have become poor and what can we do about those reasons so we can prevent poverty rather than trying to fix it afterwards when it's already done its damage. That was the first question. The second question was the flip side of the first question, which was, why do only some poor people escape from poverty but not others? What happens in their case? It's the same rate of national economic growth. It's the same set of state policies and the same umbrella of NGO assistance programs. But some individuals move up and out and others remain where they were. What's the difference? The third question, which came much later as I was doing this research, was, sure, somebody has escaped poverty. That's a happy event. But if this person had the potential to be the next Einstein, just happened to be born poor, is it enough of an achievement that this person was raised to become a day laborer above the poverty line? Is the missed potential not something we should be thinking about in addition? When I started, though, it was the first two questions about poverty dynamics. How many became poor? How many rose out of poverty? Who were these people? What were the reasons that moved them up or moved them down? And I found, to my horror, that this was around the year 2000, that there was hardly any available knowledge that could help me deal with either of these questions. What we usually had in terms of poverty data were stock data, which sort of the kind that, in the year 1980, 35% of the population of India was poor. In the year 2000, 25% was poor. So there was progress. 10% fewer people were poor in 2000 than in 1980. But how did this come about? Did 10% rise out of poverty and 0% fall in? Or did 20% rise out of poverty and 10% fall in? Or did 40% rise out of poverty and 30% fall in? All results in the same 10% net reduction. But these are very different streams. There's very little similarity between these three scenarios. They require very different policies, but we didn't have at that time the information that could help us distinguish between these situations. There were a few studies which considered very short time periods, 3 to 5 years, and did not usually ask the why question. Why did person X rise up and not person Y? Why did person Z fall down and not person A? I realized I need to develop a new methodology which would help me track households retrospectively to see in some reliable way measure what the status of these households was 10 years, 15 years, 20 years ago, and what their status is today, to develop a metric for comparing those two statuses and verifying that the measurement we'd got were the right ones, and then having verified that we'd figured out this person's trajectory correctly, to ask about the reasons that were related to that particular sequence of events. The methodology came to be known as the Stages of Progress methodology. It was adapted and used by researchers and aid organizations in different parts of the world. It relies on using a local scale of poverty that is relevant to people themselves, but has distinct scales, in some cases ranging from 0 to 16. Each point in the scale tagged to a particular asset or capability, and thereby serving as a kind of a totem pole, a scale of measurement against which individuals' economic status could be measured at the present time and at some point in the future. I can't tell you too much more about the methodology. It would require at least another 45 minutes to discuss it all, but I'm happy to talk some more about it in Q&A if you're interested. But I ended up together with colleagues in each of these countries in using these methods to look at the poverty pathways taken by a little more than 40,000 households whom we studied over 10 years in 3 parts of India, a countrywide study in Kenya, 2 parts of Peru, 2 parts of Uganda, and a few communities in North Carolina, USA that I went and studied because my students insisted. And I found that their situation in terms of the pathways households take are not very different from those I had uncovered in developing countries. The good news is that everywhere, in every one of these very different locations where I went with a large group of people to study local poverty conditions, in each case, our investigators included a large number of local boys and girls of communities similar to the ones we were studying, but who got some amounts of education, 7 years, 8 years, 10 years usually. Along with these people, when we went into these communities to find out what had been going on over the past 10 years to 25 years, we found everywhere that very large percentages of people had moved out of poverty. Fabulous story. I wish that was the entire story, but as you can guess, it was not. This is the full story. Even as many people were moving out of poverty, many others around them were simultaneously becoming poor, falling into poverty. Take the very first row of this table. In Rajasthan, a state in India, we looked at 35 different village communities of a very diverse kind, found that 11% of households had escaped poverty in the 25-year period between 1977 and 2002, but over the same period, another 8% of households had fallen into poverty. And this was the same no matter which of those 35 villages we went into. In every single village, some households moved up, some households moved down. There was not a single village in which there was only an upward movement or only a downward movement. In fact, when we later came to do these studies in neighborhoods, in cities, we found the same thing. And here too, as we go down from Rajasthan to Gujarat and Andhra, two other parts of India, Western Kenya, Uganda, Peru, and North Carolina, in every instance, in every community, we found households simultaneously going up and going down, which was a fundamental realization, because earlier I used to think that the task of poverty was principally about pulling people out. But here we find there are large numbers who are falling into poverty. Take the case of Western Kenya, for example. 18% moved up. That's fabulous. If that was all that had been happening, by now poverty would have been close to gone in that area. But instead, whatever these 80% did was nullified, overtaken by the 19% who fell in. So poverty increased even as many people moved out of poverty. Paradoxical. What we found further, trying to move this along, overall, in all these 40-some thousand households, we found that 1/3 of all presently poor people were not born to poverty. They fell into poverty because of reasons beyond their control, and I'll come to those reasons in a minute. If we had only been able to control those reasons, we'd have automatically taken care of 1/3 of all poverty. We found that falling into poverty is not a marginal thing. It's not just something that happens to those people over there. Even well-to-do households have fallen into poverty from which they have not been able to come out. Their numbers are smaller than the numbers of poorer people hovering just above the poverty line who fell in, but still, it's something that happens everywhere, in downtown Kampala, in downtown Bangalore, and in remote rural Uganda. It's not something from which people come out quickly. We found that nearly 2/3 of all households who had fallen into poverty 10 years or more than 10 years ago were still poor 10 years later when we came back for the next round of measurements. More interestingly, and here's where I come to the reasons behind both sets of movements, we found that falling into poverty and moving out of poverty respond to very different sets of reasons. Need two different poverty policies if you are to control both sets of movements. Falling into poverty happens because of a variety of reasons. It's not like falling off a rock, which happens in an instant. Multiple reasons add up to the push that a person experiences. And gradually, the combined effect of these reasons pushes a person over from a life of security, from a life perhaps vulnerable security, to a life of abiding poverty. Among those multiple reasons, the single most important reason which we found repeated in the largest number of cases of falling into poverty was bad health and high healthcare expenses. A person would fall ill or have a road accident, and the combined effects of the loss of wages, the high treatment costs, the ultimate death of this wage earner, the cost on the funeral, the debts taken to deal with those costs would add up to the surviving household becoming poor and remaining poor for long periods of time. Bad health and high healthcare expenses. Now, here's our first pointer to how this might be relevant to what we are seeing around us today. There were also other reasons for people falling into poverty, which were part of the story, part of the multiple reasons that led them into poverty. Job losses, again, something that's relevant today, high interest debts, and you see the rest of those reasons over there. Among different types of households, the most vulnerable to falling into poverty are female-headed households. These are households headed by women who are widowed, divorced, separated, abandoned. Most of them end up in poverty, even if they don't start in poverty. And the last line on this slide is something that took me a long while to establish, that even when people have fallen into poverty, or if they have remained poor for long periods of time, alcoholism, drug addiction, laziness are about as present as they are in households who have not fallen into poverty. So it's the same percentage of laziness, addiction, drunkenness. It's an urban legend to associate drunkenness uniquely with the poor and blame them thereby for their condition. We can go more into that if someone wishes to test this point. What about moving out of poverty? Two main kinds of pathways. The first kind, taken by about 25% of households in our sample who moved out of poverty, is that of improvements in smallholder agriculture. People have planted new crops, more commercial crops, better varieties of crops, more intensively farmed their lands, employed irrigation, and so on, and thereby improved yields and improved what they could earn out of agriculture. But that's only 25% of families, and the amounts of land they own are so small, and I'll show you some numbers presently, that these advances through agriculture are capped at a fairly low limit. The other route taken by 75% of households in our sample was to send one of their households members, an adult, to a city nearby or far away, where this person, usually a young man, often young women, would work in the informal sector as a seamstress, as a shop assistant, as a street vendor, as domestic servants, as nannies, cooks, maids, chauffeurs, security guards, bundle lifters, parking lot attendants, ice cream sellers, and you get the picture. And make a small amount of money, living 4 to a room, 6 to a room, but basically with the intent of saving up enough cash to send back home so that the family's cash needs are met, and the extra income that this migrant has made adds to what the family traditionally did, and that puts them over the top, but just over the top. Much less frequent is, somebody studying enough in a high-quality institution to be able to get a regular formal sector job, particularly a high-paying job. That's very, very rare. So general reasons for dissent we need to think about today are the reasons related to bad health and high healthcare expenses and job losses. And then the reasons for escape. Notice how large a wage earning opportunity in the urban informal sector figures in the stories of people who moved out of poverty. I'll bring these facts together when we start speculating together about COVID-19 and its likely effects on poverty in different parts of the world. Martha, how am I doing for time?
You still have some time because we started late. Maybe 7 minutes late. Is that okay?
Thank you. That should be just fine.
Okay.
Okay, so here's what I was saying about the limits to what people can achieve through the available pathways out of poverty. Agriculture on these tiny pieces of land can give you, 25% more from a very low base, but it's hardly enough to make you rich. It's hardly enough to make you not vulnerable to falling back into poverty again. Similarly, the informal sector jobs that people have been getting are not enough to making them out of the zone of vulnerability. Here's how I see COVID-19 and the lockdown associated with it affecting poverty both in the immediate term and in the medium to long term. Immediately, I agree with the recent World Bank calculation, which says that somewhere between 70 to 100 million people will fall below the $1.90 poverty line now. And I think, though, that we can distinguish going country by country what we think these effects are going to be, what pathways these effects are going to take, and how long lasted each of these routes into poverty is going to prevail. So let's start with what I think is our three main routes. The first is the health shock. The health shock itself can be looked at in terms of the infection rates. At the moment, all the numbers of infection rates that are coming out for developing countries, I don't trust any of them. They could all be huge overestimates or huge underestimates. The testing rates are so abysmally low that these numbers mean nothing to me. But when we start getting more reliable infection rates, which we should soon, then the next thing is, well, you can get sick, but why does sickness necessarily lead to poverty? Well, sickness leads to poverty in cases where dealing with that sickness is very, very expensive. You pay for it with the shirt off your back. And in situations where there are high out-of-pocket expenditures, which range as high as 90% in some countries, and the cost of treatment is high, the same infection rate will lead to a larger increase in the stock of poverty. More people will flow into poverty where OOP, out-of-pocket expenditures, are high and treatment is expensive. Then the next route, the sub-route of the health shock is about mortality rates. If the infection rate is high and the quality of treatment is poor, there'll be high mortality rates. Well, high mortality rates may not translate again into enhanced poverty unless high mortality rates mean that large numbers of people in income earning ages are dying, and in countries, in societies where funeral expenses are large, whereas, for example, a respected man's herd of cattle needs to be slaughtered to honor the spirits when he's dead. These are beliefs people have and continue to have. The second main route into poverty I see is the livelihood shock, and I think this one is likely to have the larger impact, and I think forms a larger part of the World Bank's calculation. And the livelihood shock is going to be larger in cases where the informal sector provides employment to a very large percentage of people. And again, the percentage in the informal sector, these numbers are available from the ILO, very large in some countries, as large as 90% in some countries, and as low as 25% in other developing countries. So again, the larger the size of the informal sector, the smaller the chance that the person has a contract to a job, the smaller a chance that the person has a job to go back to once the darn thing ends, the smaller the chance that the person has been getting some compensation during the period when the economy was locked down. Loss of wages, loss of market access, and high expenditures on healthcare, if you're squeezed between a loss of income over extended periods of time and high expenditures on account of healthcare, that leads to you liquidating your assets, your small animals first, your jewelry next, your land and your house. After that, with each step in the process of asset liquidation being like a ratchet into poverty that endures. And then the final route into poverty that I see, which predates COVID, but will probably be interacting with COVID, is this longer term trend toward mechanization of good jobs, formal sector jobs, factory jobs, accompanied by the growing informalization of the service economy, which puts more and more people into situations of vulnerability and precariousness. And then this last factor is the dispersion of the labor force in countries where the lockdown has resulted in huge numbers being dislocated, having to move back to some other place which they regard as home. Bringing them back to their workplaces is going to be a huge, drawn-out process that can take from 2 to 3 years. I'm happy to think that I haven't got it all. In fact, I'm pretty sure I haven't got it all. I'm sure there's more going on by way of interactions between COVID and poverty. So I'd be glad to discuss this and get your ideas about it, since I do plan to go out to the same 40,000 households or some subset of them, and immediately after the COVID restrictions are removed, and see what's happened to these households over there. So it'd be good to discuss what I should watch out for. I just have a couple more things to say before I finish. One of the most depressing findings of the research was that we asked a simple question in every one of the 400 communities we went to. What's the highest position in any walk of life that anyone in your community achieved in the last 10 years? In many of these communities that look at us like we were mad, what is a high position? What do you mean highest position? Everyone around here is a farmer, someone is a pastor, someone is a school teacher. So, well, the highest position that many had achieved was that of village school teacher. The second highest was an entry-level recruit into the military. This is 71 Indian villages. I'd done this research in 2012, so this is the last 10 years. I don't have anything against school teachers or soldiers. All I'm trying to say is that these are great guys. They do lots of stuff, but there's plenty of other things that people could become, because there's talents of all sorts everywhere. But yet in villages right around Bangalore, one kid in all of 70 villages, all of 1,000 plus kids who graduated from high school in this period, one kid became a software engineer. It's a story of missed opportunities, lack of social mobility that other studies have also pointed out, that many of these countries which grapple with abiding poverty are also grappling with problems of low social mobility. The kid of a poor small farmer rarely rises up to become a company executive or something like that. But nevertheless, there are some instances thrown across the world in which kids from backgrounds of considerable poverty, deep poverty, have risen up to become some of the country's best known individuals. Sometimes it is through the avenue of sport, sometimes it is through the avenue of music, sometimes it is through the avenue of literature, and sometimes it is through the avenue of regular career pathways like lawyer, doctor, engineer. So I'm looking at different kinds of career ladders, particularly at ones in different countries which have taken kids from very humble households and continue to do so and pitch them to the level of world class, whatever, world class marathon runner or world class software engineer or world class musician or something like that. And I'm looking within those for design principles that may be common to their construction, which can then be applied, hopefully, to the creation of similar ladders in other walks of life and in other countries. Let me stop here before Marta gets mad with me.
Thanks so much, Anirudh. Would never get mad with you, especially since you are doing here from far away generously for us. Thanks so much for this insightful presentation, which is chock full of very relevant policy lessons. I wouldn't want to add time, but someone mentioned 3 or 4. One is that falls into poverty are not an isolated event, including in normal times, it looks like, so that preventing falls into poverty is as important as helping people escape it. And also the fact that falls into poverty and escapes into poverty seem to respond to different sets of reasons, which argues for very different sets of policies to effectively address each of these. There's also the fact that bad health and high health expenses are the more relevant reason for falls into poverty, which is very relevant right now and which argues for the importance of Sustainable Development Goal 3 regarding the need for universal healthcare coverage. There's also the fact that the diversification of income resources is very important to escape poverty. And from your last slide, the fact that there seems to be a very low glass ceiling for people, for rural populations, especially in developing countries. And you mentioned that opportunities are not enough to escape, to move up, but you need also these career ladders, which we can discuss more during the Q&A. So let's move now to the Q&A. I'll see what we have in the box. I remind participants that they need to write their questions in the box, in the Q&A box on the right-hand side. And I'll try to report all the questions to Anirudh. Please send your questions to all participants, not only to Anirudh. So first question is, considering your findings on the dynamic nature of poverty, what would be your main recommendations to policymakers, specifically how to avoid people falling back into poverty? This is the only question for now. Do you want to respond to this one? I'm happy to add 3 or 4, but let's give it.
Let me respond to this. It's a very important question. So let me respond to this while you are on the lookout for more questions, Marta, if that's okay?
Sure.
So I would say it depends on the short-term vision and the long-term vision. Long-term, I have absolutely no doubt in saying that the best anti-poverty policy is universal, high-quality, affordable healthcare. If you look at countries around the world, the lowest poverty rates compared to GDP are in countries that have the lowest OOP, out-of-pocket expenditure numbers, because they have provided this kind of care to their people. And those are also the countries, I think, where we're going to see some of the smallest poverty impacts of the COVID crisis. But right now, I mean, in countries where the healthcare system is weak, where it's expensive, they can't fix it overnight in time to deal with the immediate pandemic. So some kind of a Band-Aid system would probably need to be provided, which is this payment, government payments for healthcare related to COVID. I don't know exactly how it would be, but it would be some way of enabling families to pay for healthcare without having to sell assets and become structurally poor. The other part of it is job loss, um, wage loss. Um, Many countries have been dealing with that by providing cash supports, by providing supports in kind like food rations, by doing what they can to the limits of their capability to help households deal with this sudden loss of cash income. Uh, I think we need to be aware that this is not going to all come to an end in 3 months or 4 months from now. Even if legally it becomes okay to start operating your workplace, socially people are going to take a long time to come back to the same level of human interaction, to the same intensity of human interaction as we used to have earlier. I think face masks are here to stay for a long time. I think webinars are here to stay for a long time. I think a lot of international travel is going to be questioned about its necessity. So I think even these income impacts we can anticipate going on in some form for 2 to 3 years. What kind of social protections are in place? What kind of unemployment compensation programs are in place? What kinds of retraining programs are in place? That will determine how deeply the present episodes bites into society.
Thanks so much, Anirudh. I would say also that for countries who can afford it, it's also important to help people keep their jobs, not only compensate them for the loss of jobs, but help them stay. So now we have questions popping up very quickly. Should we take 3 at a time, Anirudh?
Whatever you want to do, Marta.
I think it would be a good idea to take 3 at a time, and I'm going to go chronologically. How do I see the first questions? Now they have disappeared. Okay, I'm moving up. Okay, it's moving so fast. Has your research touched on the political challenges of avoiding impoverishment of households? For example, corruption in existing social protection systems, and so on. That's one. Another one is the World Bank predicts that Sub-Saharan Africa and South Asia will be the hardest hit by COVID-19 in terms of the number of people falling into poverty. What do you think are the reasons for this? And the next one, which is in the chat, let me see. I see that some people can't enter their questions. I'm sorry. Oh God. Let's start with these two because I have now lost track of the trail.
Okay, so let me start with the second question first. I think that the World Bank is right to say that Sub-Saharan Africa and South Asia will be the hardest hit. And the reason why I agree with them is because I think of it in terms of a few statistics corresponding to the different pathways that we looked at. I look at the percentage in the informal sector, and that's hugely high in many sub-Saharan African countries and across South Asia. Its percentage in informal employment is close to 70% in Bangladesh, India, and Pakistan, slightly higher in Nepal, and more than 80% in many countries in both East and West Africa. So that's one statistic. The other statistic is the quality of healthcare as reflected in, for example, life expectancy. It's closely related to maternal mortality. So either of those statistics. And again, those numbers are pretty poor in South Asia and Sub-Saharan Africa. The third statistic I look at is coverage by social security schemes of different kinds. And again, those numbers are poorer in the same group of countries. So it's a sort of a triple whammy. It's multiple routes into poverty are more open, have become more open in this group of countries. The first question, that's the tough one. Have I looked at the political challenges and the administrative challenges? Well, as a former administrator, what Martha didn't tell you is that before I got into this research business, I spent 15 years working for the government of India and the Indian Administrative Service. So clearly, I should have looked very closely at how corruption and government failures of other kinds are important to the experience of poverty. Maybe I didn't look hard enough, but here's what I found. I found that for large numbers of people, particularly in rural areas, the interactions they've had with government and particularly with NGOs are kind of small and kind of distant and kind of superficial insofar as their own livelihoods are concerned. Yes, it would certainly help if the aid that government promises, if the free food rations or cash incentives that the government promises can be delivered without corruption. What matters much, much more to me, the way I see it, and we could argue about this if you like, is the sloppy standards of public health care and public education in many, many countries, particularly in the regions mentioned in the World Bank report. This is a crime because by giving kids, many of whom are first generation learners, by giving them crappy education, what you are doing is you are destroying the faith that people have in the whole thing about education. These kids will go to school, are going to school, have gone to school for 8 years, 10 years, 12 years, learn very little that's helpful, see no improvement, economic improvement in their lives, compared to other kids who dropped out of school 6, 8 years earlier and have been earning some income that whole time. What's the use of education? What was the use of staying in school for an extra 8, 10 years? That's where I think I would come down harshest on the failure of states to perform in places where they are not performing. But correct me if you see it differently.
No, absolutely. I'm absolutely not correcting you. I think it's a very pervasive form of failure that is not limited to developing or poor countries. It applies to developed countries, some developed countries as well. We have lots of questions. I'm going to choose. We have 8 minutes left, so I'll go ahead with 3, and I'll see if we can ask more later. And what are your thoughts on the presumed trade-offs of lifting lockdowns with regard to poverty? The other one is data from the data from the 17 Indian villages surveyed is interesting, considering the impact of television and images of success, etc. How could the caste system or lack of local empowerment initiatives lead to such outcomes? And then the third one, in your research, have you found a significant percentage of people who have risen out of poverty only to go back again?
Yeah.
So let's keep it to this.
Yeah, thanks. These are great questions. Again, let me take them in reverse order.
Mm-hmm.
So yes, we found lots of examples of people who've risen out of poverty only to fall back again. I'd like to introduce here a distinction that's drawn in much of the writings about poverty between transient poverty and persistent or chronic poverty. So it could be that usually I'm not poor, but once in a while, I experience poverty. I experience an episode of poverty. So, for example, this coronavirus thing, if I am losing wages now, I can't go and work because of the lockdown. If you were to calculate my monthly expenditure based on my daily expenditure today, you'd find it's below the poverty line. And so for the next 3 months or 6 months, I may be below the poverty line. But if you come back 6 months later and I've got my old job back, and for the next several years, I won't be counted as poor. So there are many, many households that have become transiently poor and then risen back, or that have become transiently non-poor and have fallen back to a usual state of chronic or structural poverty. And what I think, the reason that I think this is very relevant now and why I thought this was such a good question is because I think the best question countries should be asking themselves at this point is, uh, what do I do so that this increase in poverty is all transient and very little of it, if any of it, becomes chronic or becomes structural? Um, I think that's the key question.
Mhm.
Do I have a answer that can be applied in every context? Man, I would patent it and sell it like gold if I had that answer. um, yeah, the 71 Indian villages, TV, yeah, they see TV and to become TV stars, but no one like them has become anything like that. What they see around them, the highest paid, most educated, most respected person they see around them is the school teacher, is some guy who joined the military or joined the paramilitary, and once in a year when he gets leave from his job, comes back and flaunts his new uniform, and you know his parents have built a nice big house. And yes, on TV they see singers and America's Got Talent equivalents, and but those people are so far away. No one like them has ever become that. So yes, you can dream of being that, but you can't. You don't plan to. And it's very interesting. I was asking these responses from a lot of people, and one little girl said she wanted to become a flight attendant. The term she used was air hostess. I said, in this little village, I said, yeah, that's terrific. You want to be something that no one else has mentioned, but how did you come to hear about air hostesses? So she says, oh, my father's brother works in a office in the city, and one day his boss took a plane ride, and this magical creature, this air hostess, appeared, and he decided then and then that I, this little girl, I'm going to grow up to become an air hostess. I said, that's fabulous. What do you need to do? What do you need to study? How does someone become an air hostess? How do you qualify? Completely blank. No idea.
Mhm.
You know, and that's the problem. Is that
Yeah.
it's not that they don't know. It's that they don't know how to. It's that they don't know if they can. And so one of the things I'm studying is a bunch of organizations I call social mobility promoting organizations, which have sprung up uh, in various parts of India, in various parts of sub-Saharan Africa. I haven't looked globally. That's the only two places I've looked, which are working on these very same factors: self-confidence, information about different career tracks, motivation. Yes, you can do it. Yes, you want to be an air hostess? Come on, we'll show you what you need to do. We'll help you develop the skills you need to develop. Yeah, okay, let me stop there. And sorry, the last question, trade-offs. Do I know what do I say about the trade-offs between lockdown and poverty? I say it's a very hard trade-off. It's a very hard trade-off. I am in touch with some people who work as my research assistants who are themselves slum dwellers in Bangalore and one other Indian city. And I've been talking to them every other week. And in the beginning, it was, these were people who went out every day and worked, and based on what they earned, uh, they could eat. They needed to go and cut some firewood from the forest nearby to be able to cook their food. But there was a lockdown, and the police weren't letting them go anywhere. And so the stories I heard were very interesting ones about how these informal accommodations were achieved between informal local leadership and the police, which enabled a humane solution to come about.
Right. Yeah. And I wonder how effective the lockdowns are after all in this kind of poor setting. So, Anirudh, it's almost time. Do you have time and appetite for 2 last questions?
Sure.
Yeah, it would be 5 minutes tops. So one is, it's a general question that comes out from the whole of your presentation, is based on your research, what then are the different policy measures that you need for preventing poverty versus helping escape poverty? And the last one is someone who would like to hear more about the similarities that you found between household dynamics in North Carolina in the US and in developing countries, and if policy solutions would differ in the US compared to developing countries. So both dynamics and policy.
So yeah, these are great questions. Again, let me make a habit out of it and take the second question first. North Carolina was fascinating. I mean, the most fascinating thing was it was actually put into words by one guy, one elderly guy whom I met, who served as a missionary in different parts of the world, a Christian missionary, and then retired to live in this community in the hills in North Carolina. And he said, this is very interesting. 40 years ago, it would be someone who looked like me going out to someone who looked like you and asking them about poverty. And I said, that's precisely what makes this so interesting for me. What I found was that the measure of poverty, the threshold, the point below which someone is deemed as poor, is much higher in North Carolina than it is in Uganda or India or Peru, as it should be. If you look at the dictionary definition of poverty, it's always relative to society's expectations and achievements. And the caveman's definition of poverty is very different from ours. But the factors that take them out of or into poverty are very similar. It's the same story in North Carolina is, someone lost a job, but that wasn't enough to pitch them into poverty. Someone lost a job and with it their health insurance and had a healthcare incident at that time. These people invariably became poor. And the experiences of rising out of poverty were also the same. It was that, not so much the informal sector, but getting a job that was better than the previous job you had, both in terms of how much it paid and how predictable that job was, how long you could expect to hold it. And that relates in turn to the first question that you asked me, Marta, about what would be my policy suggestions about preventing poverty, universal, high quality, affordable healthcare. I keep saying that like a broken record. And my suggestion about improving pathways out of poverty, I have a long list, but I'll just mention 2. The first, I would say, is the progressive formalization of the informal sector. You can't wish the informal sector away. It pays for the livelihoods of way too many people. But it's not necessary to immediately convert all these jobs into, fully formal jobs either. That's, again, probably not feasible. But I think society should aim at recognizing that these people who work in the informal sector will also grow old and need pension supports. They also need healthcare supports. They also need some continuity of tenure, so maybe annual contracts, some kind of contracts. They also need some kind of protections against workplace injuries and so on. I think that the improvement of the quality of jobs is one very important thing. And the second, I would say, is opportunities for social mobility. Just because someone's born poor doesn't mean they should be forced to accept the first bad job that's offered to them.
Absolutely. Well, thanks so much, Anirudh. We won't take any more of your time. We have exceeded your generosity already. Thanks so much for this exciting presentation. Thanks so much to all participants for being with us during this hour. I think this webinar is being recorded, so it should be, right?
Yes. Yes, ma'am.
So it should be available to everyone shortly. Thank you very much. And
thank you all.
Thank you, and we will be in touch.
Thank you.
Take care. Thank you. Goodbye.